Hello, everyone, and thank you for joining the RSSA webinar, The Future of Teleradiology in Saudi Arabia. My name is Tam Linjawi, and my presentation is about the evolution of teleradiology in Saudi Arabia. To start with, just a quick touch on what is teleradiology, although I'm quite sure that all the audience is quite familiar with teleradiology as it has been in the market, in the international market for a couple of decades and in the Saudi market for a few years. It is basically the ability to access, manipulate, and read radiological images remotely by gaining access to the archiving of these images on a local server or a cloud server with the use of picture archiving and communication systems. It allows physicians and patients to have access to the images and reports remotely for reporting, viewing, and consultation. Historically, the first documented teleradiology study was published by Professor Edward Sickles from the University of California, San Francisco. It was a telemammography study that was conducted between September 1997 and 1998. It included about 400 patients over the 2 years period being scanned via mobile mammography units. The aim was actually to investigate the electronic transfer of digital mammography images to remote viewing sites and assess and demonstrate that remote interpretation of these images by expert mammographer is as effective as conventional film interpretation. That was the very first published teleradiology study. In Saudi, history of teleradiology goes back to the mid and late 1990s. Between 1996 and 2000, both King Faisal Specialist Hospital and Research Center in Riyadh, as well as Aramco Hospital, had their own second opinion and consultation services to their patients by sending these images to selective institutes in the States for second opinion. There was a private company by the name of World Medical Consultation established by Dr. Hassan al-Sharif in Jeddah that also allowed private hospitals to use their facility and their service to send images for second consultation, second opinion from Ivy League hospitals in the States. Between 2000 and 2003, there was the initiation and start of entrance of international teleradiology companies, primarily from the States, into the Saudi market. My first encounter with this was in 2004, where I was personally approached by one of these companies to be one of their readers after they have been rewarded a contract for a major public hospital in Saudi. However, I did not take the offer as at that point there was no guidelines or legislation for such practices in Saudi. However, that initiated the effort from myself as the president of the Radiological Society of Saudi Arabia at that point. It was a newly established society. With the help of Dr. Abdurrauf Maimani, who was the head of the scientific committee at the Saudi Council of Health Specialties at that point, and we drafted the first teleradiology practice guideline, and we presented that to the Ministry of Health, who was represented at that time by Dr. Ali Al-Misnad in Riyadh. The very first teleradiology license in the history of Saudi Arabia was actually awarded in the 24th of Muharram, 1433 Al-Hijrah, which corresponded to 19th of December 2011, meaning 11 years ago. And that was awarded for Muhammad Saeed Tamr Company in teleradiology, Markaz Tibbi Ittisal al-Ash'a. That license was for 5 years and it was never renewed. But that was the very first teleradiology practice license that was issued in the history of Saudi Arabia. Currently, We have almost at least, to my knowledge, at least 10 national teleradiology companies who are licensed and in some sort of practice. So why do we need teleradiology? Well, obviously, to resolve the radiologist shortage, whether lack of availability of expertise or even lack of radiologist presence at remote locations due to geographic factors. We also need teleradiology to cover on-calls and holidays shortage. We need it for second opinion and expert consultation from experts in the field who are not available at the site of the examination. It can be used for work redistribution within a network. If any network that owns or manages several sites, this would optimize work redistribution and efficiency. We minimize at the same time cost and maximize expertise utilization. And this brings the economical factors, which are also important in this field, as it reduces the cost of expertise and increase efficiency of performance. Now, teleradiology can be business to business and business to customer. When we talk of business to customer, that means patients having direct accessibility to radiologists so that they can send their images by dedicated systems or even by emailing services, loading the images on specialized systems that would allow remote accessibility of the images for both patients and doctors for reporting and second opinion consultation. This gives the patients the control of their own medical records and images, which might be a debatable issue as it has its own benefits and has own drawbacks. Business to business presents several modules. There's the intra-hospital network, where the images being distributed from the radiology department to various departments within the hospital, such as outpatient department, OR, ER, etc., using the PACS and the RIS systems. There's point-to-point module, which allows radiologists from outside the hospital to access the hospital server for reporting after hours and on calls and holidays. There's the enterprise network, where a particular enterprise owning or managing several sites manage to give accessibility to their physicians to the whole network to improve patient care, facilitate patient transfer, improve the turnaround time of reporting, and optimize expertise utilization. And there is the cross-enterprise platform, whereas a platform is being allowed to receive images and medical records from different vendors and different utilizers and place these images on nationally accessible servers or cloud servers to allow physicians and radiology firms to access these images from different servers and different reading points, such as the platform that is proposed by Lean, as I believe will be presented by Lean presentation in this meeting. So in the first three modules, the hospital network, the point-to-point, and the enterprise network, this has the advantage of that physicians have direct, unrestricted access to the electronic medical records, the images, and for physician consultation and communication. However, when you have the cross-enterprise national platform, there's the disadvantage of having limited access to electronic medical records, previous images to compare with, and communication with referring physicians. So who are the stakeholders in Saudi Arabia for teleradiology? Well, there are the utilizers, which are the agencies that require or requesting the service, which are primarily hospitals, polyclinics, and radiology centers. And those are the ones that are driving the market in terms of need and pricing. And there are the providers, which are the single radiologists or radiology firms who are under the influence of the utilizers in terms of demand, need, and pricing. The regulator and the logistic support, which is in the middle, a very critical part should be played by the regulator and logistic that is missing so far. And this goes for the Ministry of Health, LEAN as the representative of Ministry of Health, SADAYA, the National Cybersecurity Authority, as well as the cloud server providers and the IT network providers such as STC, Mobile, and Zain. Now, what are the concerns and the risks in teleradiology? And who's losing? Well, there are several concerns. There are medical concerns because lack of clinical data and prior imaging at the time of image interpretation and the limited interaction with referring physicians may result in defensive, non-conclusive reports or unnecessary X-ray investigation. And this leads to inaccurate assessment and reduced patients' care quality. There are legal concerns and risks in relation to the responsibility, accountability, and liability of wrong reporting. There is the so far non-implemented control for licensing and accreditation of radiology and firms to practice teleradiology and to limit the unauthorized subcontracting. Financial factors are extremely important and crucial as it is being controlled currently by the utilizers, by the agencies that is requesting the service, because there's a trend to reduce cost and reduce the human capital involvement. Minimum number of radiologists at lower cost of reading. And this will definitely impact the quality of service and may push radiology firms to subcontracting, announced or unannounced subcontracting, which will definitely reflect negatively on patient care. There is the major impact on education as it will affect residency training programs and fellowship programs because radiologists will be more and more involved on online teaching and remote image interpretation, which limit the senior consultant to the junior radiologist and the trainee daily interaction and hospital interaction. And definitely this has its own impact on the training programs. There's the lack of standardization and lack of quality control, which will be primarily responsibility of Ministry of Health and LEAN. There is the risk and concerns regarding patient confidentiality and electronic medical record accessibility and information leak. And this has to be also dealt with the National Cybersecurity Authority and SADAYA as well. So what are the threats? Well, there are threats that are related to the legislation because currently there is no quality control, accreditation, security and safety, liability. All these guidelines for practice are currently missing. There is the personnel and the marketing disputes among the national teleradiology providers, which weaken them and reflect negatively on the radiology profession and the career image. It also reflects negatively on the teleradiology value as being perceived by the utilizers. It's certainly impacting the radiologist's interest and increasing their dissatisfaction and disappointment in this field, and may also impact the interest of physicians to specialize in this area. So these are very important issues that have to be dealt with. There is the inevitable cross-border teleradiology entrance into the local market with international companies coming in with competitive performance and quality and lower pricing. Artificial intelligence in some way will also have its impact as it may be utilized as a first-line screening tool to give wet reporting and initial screening programs. On the other hand, there are opportunities for the national teleradiology providers, as they should capitalize on the global shortage of radiologists, the growing acceptance of outsourcing of the service from hospitals, the public-private partnership and the privatization program being initiated by the government, the support that the government is providing to small and medium-sized private companies, cutting down on public expenditure by the MOH and subsidizing the private sector for this. The improvement in the IT infrastructure should also be used by the national health providers and national teleradiology providers as an opportunity. Now, there's also an opportunity in participating with the legislative bodies to draw the guidelines, the policies and procedures, and to fashion and design the appropriate teleradiology practice in the country. And national teleradiology providers should get together and form stronger alliances locally and internationally in order to become competent and efficient to compete with international firms who will sooner or later enter the market and become more efficient and more confident. The other threat comes from mHealth, mobile health, which is becoming a trend and a fashion and has major concerns and major risks, as people now started to give opinions using smart applications, smartphones and tablets to give wet reporting, second opinions, and even teaching sessions. And this has its impact on reducing quality of service, accuracy of diagnosis, as clearly we all know that the image quality as we perceive it on the monitoring, on the radiology monitors that are dedicated for reporting is significantly more superior to the low resolution image you get with smartphones and tablets, and this will impact healthcare and patient management. So what can we do to improve teleradiology practice? Well, we should work on improving the utilizer's perception of teleradiology. It is not a matter of reducing cost. It is not a matter of cutting edges and cutting corners in radiology practice and radiology investment. It is a matter of improving quality, improving turnaround time, providing better patient service, providing expertise opinion, and that comes with its price and that comes with its value. This perception that is currently existing among utilizers of cutting down costs should be stopped. Similarly, we should improve the radiologist's perception of teleradiology. It is not actually using the juniors for giving them lower pay to get maximum outcome for less cost on the radiology firms. This is a wrong perception. Similarly, for those who are seeking to be practicing teleradiology only for difficult and challenging cases, that is not always the case, because the majority of the overflow from hospitals is for the bread and butter cases where you are actually reporting standard, regular, straightforward cases that does not add much to your educational career or your expertise and knowledge in your field. That also has to be clearly expressed to the radiologists. National legislation has to be there and has to be implemented, and the use of national teleradiology platform to improve quality and make quality assurance obligatory. Similarly, to make it obligatory for service providers to use accreditation programs and accreditation pathways to accredit radiologists and firms. Similarly, there should be closed performance evaluation by LEAN and other agencies for double reading, for report sampling, to ensure the quality of the service, to ensure the security of the patient data. These are all areas that we can all work together on to improve teleradiology practice. I aimed in this presentation quickly to go through the status of teleradiology historically and the current situation we have in teleradiology, highlighting the threats, the opportunities, the advantages and disadvantages of this practice. And I hope this initiates discussion among the audience and the panel of expertise and specialists in this webinar. Finally, I recommend that you read this article published by Dr. Khalid Shamrani and Dr. Abdelkader Ginawi, Teleradiology Public-Private Partnership in Saudi Arabia. It's a review article, very good one to read, as well as go through the legal regulations for telehealth services issued by Ministry of Health. Thank you very much.